So what we could do is just start a conversation in a way that you talk about the things that are important to you and the things that you would like someone to know who's coming here for a visit, international tourism, whatever. Where would you like to start?
Thank you very much for coming here in the first place. I'm really happy that you were satisfied with it. Know that Apollo Group in India is one of the leading healthcare groups in the country and the second largest worldwide. Apollo Group started sometime in 1982 and this is the 25th year of our existence under Dr. Pratap Reddy, who is the chairman. And it has taken a very big step towards modernizing and improving the patient care all over the world, including in many parts of Middle East, Africa, Europe and other places.
You were saying that this is a new thing, that you're starting with patient safety.
Yeah, patient safety in India is a great concern, and Apollo Group and Apollo Hospital Ahmedabad obviously is trying its best to improve the patient care and the patient safety. Our group's logo is touching lives, and that means a lot, even in simple terms. And our aim is towards that. Now, today the medical practice has become a bit complicated. It's more of a instruments, equipments, and less of a personal touch. We still maintain that the personal touch with the doctors, nurses is important. If you look at our group's logo, it shows a nurse holding a torch.
Yes.
It started from the beginning. So we pay a lot of attention to doctors and nurses to make sure that the patient care is at its best. Equipment, technology comes fast, the latest one, and touching life remains our main motto.
You know, in my experience with the hospital, I got better service than I could have ever imagined in any other place. And the main thing I noticed is that where someone in the U.S. might take 1 hour, it would take 5 hours to make sure that what you got was exactly what it was supposed to be. And this I appreciate, I think, more than anything. And there's a saying that things roll downhill. And so the tone that you set spreads itself out as it goes through the rest of the
My aim in this part of the world, which is the state of Gujarat, is to redefine the patient care. Now, patient care is traditionally patient care. I mean, there are a lot of things which happens. But with the modern age, with the new equipments, new technology, new sort of research which goes on, we try to redefine how do we do it in future. For example, we have recently gone into agreement with an American company, Site, and this will be one of the leading national center of excellence for stem cell transplantation and cord blood storage and all that. So these are the futuristic things which you have.
That's a cutting edge technology thing
Yes,
that you're doing here.
yes.
Stem cell research has been hindered a bit in the U.S., as you probably know.
Yes.
And so my interest, of course, is I'm wanting some implants in the future, and I'm interested in where that goes. And so when you mention stem cell research, I'm not all ears for that. I'm sure many other people in the U.S. are interested in that as
Yes.
well.
We already have agreement signed, and the stem cell people are revisiting us again in June, and let's see how it goes from there. But we want to be operational by the end of this year.
So are there other areas for medical tourism that you're starting to develop?
Yes. Other areas, we first start with our own preparation to receive the patients. As you and your wife, as yourself experienced, we have a wonderful 7-star
Yes, it was. It was the best.
international patient wing, which we call Platinum Wing. Now my aim is to put people over there, the human resources, who are trained and they look after, they are capable of looking after, whether it's a doctor, whether she is a nurse, whether she is a customer care, or whether she is even a simple cleaner of the system in the rooms. So these are the training which we are imparting on these people. We have started receiving a number of international patients, as you have seen, from Nigeria, from Ethiopia. We had one from Russia the other day. We had one from I think US the other day. And this is the thing which we want to exploit, because you see, in our part of the world, the medical management or treatment and the times for it is much cheaper and early than probably anywhere in the world. In the West, especially, where you have to wait for 6 months to 1 year, even for a bypass surgery, and when it comes to it, it is very costly. You may have seen from our brochure that we are very competitive, very cost effective. And when I say something cost effective, it means the amount which you are going to spend on a particular procedure in USA or UK or Europe, you can spend half that amount traveling to India, staying in a hotel, and undergoing the same management.
I think you understated that just a little bit, at least in my case, because it was 25 5% of what I would have had to have spent for the same procedure in the US. Now, I'm sure there's a great variation. I understand if you have to import technology from other Western countries, for example, you have to reflect those costs in that.
Correct. What Apollo has done is, we have the same manpower in many parts of the world. What Apollo has done is brought them back, trained to got the latest of equipment. We have here CT64 in our hospital in city center, where we do the latest cardiac scan, in which we can tell you whether your coronary arteries are blocked or not going to the conventional, painful, invasive procedures. These are non-invasive procedures. Within few minutes, we tell you whether your coronary arteries are blocked or not. Like let's take the example of colonoscopy. Colonoscopy is a very painful procedure.
Yes, my wife had that.
Yes, in this 64 CT slice colonoscope, we do virtual colonoscope. It is all imaging and it gives the same results.
So let me understand that for someone who doesn't understand the technology that you're referring to, you have is it like a CAT scan that is able to make a three-dimensional image, and this is non-invasive to the degree that they can have it without that painful procedure.
Right. You're absolutely right.
That is a concern with many people. They don't like the pain of that.
The other thing which we are trying to improve here is the customer care. We are taking action at every level, and we have employed a new system called mystery shopper. Somebody comes whom we don't know, it is sent to the group, he does the mystery shopping, going to the wards, going to the whole process of patient care.
No, that's an interesting thought. That's a very good idea, as a matter of fact. So you literally send someone in so that they can act
We
as
don't
if
say
they're...
the Apollo top management.
So you don't know who they
We
are.
have no idea who, when he comes, who is he, what he does.
And so they give a report back.
They
as
get
to
it
the
back
quality.
directly and then the feedback. And we are the second best customer care this month in the whole of our globe.
Well, I can appreciate that because it sure felt that way to me.
So there are many other such activities. I have started this wow thing,
Mhm.
but we have just decided the spur of the moment is why not make our customers like people like you who are the patients happy with the memories of this hospital. So we decided we'll take a photograph, we'll frame it and we'll present it to every
That was a very nice photograph that you gave me, and I didn't expect that, so I was really pleased.
whom will be discharged. So these are the small things, it's not that big thing.
But that's a lasting thing.
Yeah,
They put that on the wall. That's a lasting
That's the
thing.
lasting thing. So lots of such activities are now on the
Horizon.
implementing stage.
Yes, yes.
We are doing it, and hopefully as the days passes by, when we get more and more patients and the staff get tuned to the whole new system, it needs a change of mindset at every stage in life. I suppose you have to think of something new all the time. Innovation.
Yes.
Whether it's innovation in technology, innovation in customer care, innovation in patient care, all that is the same. But the fact is, unless you do innovation, you really cannot progress.
You might stagnate, in other words. You're either going forward or backwards, yeah.
Exactly.
Yeah. Are there other things that you would like to communicate to someone that might consider coming to Apollo here in Ahmedabad?
Yes. One other thing which I would like to say that here we are very personalized care, number one. Number two, we are very cost effective. Excellence do take place in medical field, that cannot be assured, but as much as possible, we have the topmost doctors, nurses, and equipment. So on that front, I think we are comparable to any other hospitals anywhere in the world, a good hospital. Third thing is that this is a very friendly city. It's a very peaceful, calm and quiet, and not much of problems. Hospital is beautiful.
Yes,
As you have seen yourself.
the grounds are excellent, well kept.
It's a spread over a huge area, there's beautiful lawns, grounds. We are now starting all type of services, for example, the Vestal services or any other thing which you want to have it. Interpreter services for patients who are coming from abroad who do not understand the local language, for them we'll have interpreted too.
So you're going to have an interpreter
Yes.
that will, from various countries, what country? Many countries?
No, we are having a contact with some of the, depending on what the countries we get. Right now we get more from Africa, Middle East, US and Britain. So in Britain, US is not a problem because you all speak English.
Right.
Africa, Middle East is a problem. And we have, I myself worked in the Middle East for 25 years, so I speak Arabic fluently.
Ah.
So they don't have to really bother
Right.
with Arabic interpreter. So various other interpreters, like suppose the other day there is a lady from Russia, we have some contacts in the city, we just go down to mobile, she talks to them in Russian, he tells us what she's told us in English, and that sort of thing happens. So that's communication is no problem.